Good morning, everyone. Happy Convocation Day. Thank you for joining us. If you will please stand, we are about to begin the academic processional.
Well, good morning, everybody. It's really great to be here on a beautiful morning. Please remain standing for the singing of the national anthem. It will be sung by one of our 2023 graduates, Reedy Irwin, who's graduating from the Master of Health Administration program in the Department of Health Administration and Policy. Reedy?
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free?
Everyone, please be seated. So, Reedy, thank you again. For anybody who was here last year, Reedy sang the national anthem. And Reedy, there's some notes here on the side of my agenda that says that we're bringing you back again next year. I know they said you were going to graduate this year, but thank you very, very much. So, good morning, everyone. It's a beautiful day, and welcome to our 40th annual convocation ceremony in the Hudson College of Public Health. My name is Dale Bratzler. I am very privileged and honored to be the Dean of the Hudson College of Public Health. And on behalf of the entire faculty, the students, our staff, we so thank you for joining us. We were just commenting that this particular convocation always has such a great turnout, and we're so happy to have you here. We have an outstanding graduating class this year, so thank you for being here to help us celebrate the new graduates. You know, the Hudson College of Public Health is the only accredited school of public health in Oklahoma. We're very honored to do the things that we do to educate students, to serve the state of Oklahoma in our three-part mission. First is the education and training of public health professionals, and I think you'll see that we've done a very good job with that this year. Second, the discovery of new knowledge through research, transfer of research into practical use, and for protecting and improving the public's health. You know, this cohort of students had an interesting experience in the Hudson College of Public Health this year, because this year was pretty normal, but last year we were really deep in the throes of the COVID pandemic, and truly everyone got to see public health in action. Our third mission is to provide service to our public health agencies and our citizens at the state, local, and national level. And truly, throughout the pandemic, so many of our staff, students, and faculty were so engaged with the public health response in Oklahoma. We're honored to get to work with many collaborating organizations, and I couldn't begin to name all of them that participate in the education of our students. It really is a large number of organizations. But in particular, I want to call out three public health practice agencies that we work with routinely: the Oklahoma State Department of Health, the Oklahoma City County Health Department, and the Tulsa City County Health Department. Not only do they participate in the education of our students, providing practical experiences for many students, but they also participate in some of our teaching. So on behalf of the Hudson College of Public Health, I certainly want to thank them for their partnership and their commitment to helping us with professional career development. I wanted to introduce one person on the stage with us. Certainly it's our college's, real pleasure to have Jill Raines, the Vice Provost of the University at the Health Sciences Center, join us for convocation today. She's here also to celebrate her daughter's graduation, which you will see later. We're grateful for her leadership at the Health Sciences Center. If you don't know Jill, she's just an amazing person who has served the university both in the Norman campus and the Health Sciences Center campus. Is truly one of my most trusted colleagues that I get to work with. So, Jill, thank you for joining us today. I'd also like to share that Dr. Gary Raskob, who actually oversaw this particular activity for 20 years as the Dean of the Hudson College of Public Health. He is an outstanding colleague. He is the Provost for the OU Health Sciences Center, so he moved up and is doing very well. He had actually scheduled to be here today, but because of some scheduling changes, had to contact me and let me know that he couldn't be here this morning. But he wanted me to make sure that I gave his sincere congratulations to all the graduates and best wishes on this very special day for you. So thank you, Provost Raskob. So at this point, it's really my pleasure to introduce Gracie Piercy. She is one of our graduating students. She served as the social chair for the Hudson College of Public Health Student Association, highly engaged in developing all sorts of activities at the Hudson College of Public Health for the benefit of college's students, faculty, and staff. She established a mentoring program to connect new students with current students. She helped our student services team plan new events for student orientation, and she planned many of our college's Welcome Week activities and National Public Health Week activities. She's been such a strong advocate for public health in our college. She's volunteered on many, many occasions to connect with our undergraduate students and many career options available to them in public health. She's graduating with a Master of Public Health and Health Promotion Sciences today. She recently began her public health career at the Oklahoma State Department of Health, again, one of those key partners that we work with, and we're so grateful for Gracie's service to our college, and so pleased to invite her to share a few remarks with us.
Hi, thank you so much for that introduction. I am so honored to be speaking today on behalf of the 2023 graduating class. First and foremost, I'd like to thank the faculty and staff for their contributions to our academic success and the field of public health. I know that Student Services is celebrating because now that I'm gone, the doorbell into their office is going to ring way less. Before I begin, I would like to take a quick moment to thank some of the people who have had a tremendous impact on my life. I do want to name everyone, however, Joey gave me a time limit, so sorry, Dad. But my sincere gratitude goes to the ones who made my graduation possible. Your presence has always been comforting to me. I'm immensely grateful for all the love, kindness, and appreciation you showered me with. It is truly my privilege to love you. I am so honored to be speaking on behalf today. Most of us began our degrees alongside COVID-19. COVID thrust public health into a position that shined a light on not only public health's importance, but the difference that it makes in our world. And no, I would not be a public health leader if I didn't talk about COVID. I want to focus today on not only the opportunity COVID has created for us, but the responsibility that we must embrace to be leaders in upholding a safe and healthy world. Over my past 2 years, I have had the privilege of watching my colleagues turn passion into action. The group that sits before you today has proven it in multiple ways throughout my 2 years at the college. Just to name a few, many have published academic papers that will lead to future public health innovation. Students have spent their free time advocating and fighting for public health services in the state of Oklahoma, and many volunteered to work on the front lines of COVID-19 to vaccinate thousands. I think we can all agree that working towards our degrees has not only been about gaining knowledge, but growing our ability as leaders, learning to contribute to the greater good, and of course, having a knack for finding free food because we are grad students. One of the most unique things about the field of public health is how there are so many career options. As we all go off to pursue our different dreams, we will always have this experience in common, as well as the responsibility to ensure that public health stays at the forefront of healthcare, not only to prevent pandemics, but to spur innovation and create a healthier and safer world for the next generation. However, I'm certain that this will not come without its challenges. In times of hardship, we can be confident that we will have each other, everyone from the college, or you could use my most favorite coping skill, Taylor Swift lyrics. Okay, just me, that's fine. Anyways, she says, just keep cruising, can't stop, won't stop moving. When things get hard, keep fighting. One of my greatest privileges is the relationship that we have got to form with the faculty and staff. Whether it was Dr. Bratzler coming to Donuts with the Dean, or Dr. Stevens joining the Student Association and making Valentine's for the kids for an hour and a half when he definitely had a grant due. There was no doubt that they would make a difference and show up for us, not only in the state of Oklahoma, but in public health as we know it. We are so lucky to have them as our leaders. Our professors throughout the year have encouraged us to dream big. They refer to it a lot of times as pie in the sky kind of dreams. We have spent hours talking about the dreams and the impact that we want to make on our community. They have not only encouraged these dreams, but they've supported it. However, we know that it may not always be that way. So one of my favorite artists, Ben Rector, sings in his song, dream on, when the world says you're crazy, just tell them you're wrong and dream on. Congratulations to the graduating class of 2023.
All right, thank you, Gracie. That was just great comments, and thank you very much for all you've done for the entire student body, the Hudson College of Public Health. So now my honor and privilege to introduce our convocation speaker. The convocation address is the 2023 Delta Omega Society lecture, and you'll hear more about the Delta Omega Society later in the program. So it's certainly an honor to introduce this year's speaker, Ms. Julie Bisbee. Ms. Bisbee serves as the Executive Director of the Oklahoma Tobacco Settlement Endowment Trust, TSET. And if you don't know about TSET, please take a few minutes and look up the organization because it is truly amazing in our state. It's the state's endowment trust focused on reducing Oklahoma's leading causes of preventable death, tobacco use and obesity, in order to reduce both cancer and cardiovascular disease, which are the two biggest killers of Oklahoma. As a state grant-making trust, TSET funds prevention, research, and emerging opportunities to improve the health of every Oklahoman, and our college has been truly blessed to be a close partner of TSET in assuring a healthier future for all. I know many of our faculty work with TSET routinely. Ms. Bisbee joined TSET in 2012, serving as the Director of Public Information and Outreach after a 10-year career as a journalist and service as a Health Policy Director for the Oklahoma Institute of Child Advocacy. In her first role with TSET, she was responsible for communicating with lawmakers, policymakers, and stakeholders about TSET's impact on the health of Oklahomans. And I know that our faculty have had the opportunity to work to help to measure some of that impact from the TSET funding and the work that they do. Ms. Bisbee has represented the agency at the state legislature. She's led statewide efforts to inform the public about TSET-funded work to reduce the leading causes of preventable death. Following Ms. Bisbee's career as interim director for TSET, the TSET Board of Directors unanimously voted to appoint Ms. Bisbee as TSET's executive director in March of 2019. Members of the TSET board have recognized her exceptional understanding of the intricacies of TSET operations, along with a passion for and vitality for innovative thinking and her commitment to maintaining transparency, accountability, and continuity, something so needed in many things that go on today. Ms. Bisbee earned her bachelor's degree in journalism from Ball State University. She's completed the Governor's Executive Development Program for state officials, and she completed the Legal Assistant Program at the University of Oklahoma College of Law. So please join me in welcoming a true champion of public health, Ms. Julie Bisbee, to present the 2023 Delta Omega Society Lecture.
Good morning. That's quite an introduction. Thank you. Thank you so much. It's great to be here with you all today. Congratulations, graduates. It's an honor. What an accomplishment you have achieved to get to this moment. Savor this. You've worked hard. Take a look at this audience. You see your family, your partners, your friends, faculty, and staff. They've all surrounded you with support and encouragement. Like Gracie said, this is your community. And as we know, we don't achieve things alone. We achieve them in networks and with support of others. So thank you to your support network who is here today cheering you on. Don't worry, you'll call them later. You'll need them. You are on your way to an exciting career. So many options and paths lie ahead of you. And this is exciting work. As you said, many of you started your studies in the midst of COVID pandemic, and never has public health been more important. This pandemic highlighted how strong public health systems can protect lives, contain threats, and help people live longer, healthier lives. The isolation of the pandemic also highlighted to us that connection is vital and essential. In the face of all that we've lived through over the past few years, you are doing something very brave. You are committing to something bigger than yourselves. I'm thrilled to welcome you into the fold of public health that includes great leaders who have achieved so much for our state and possess the grit to keep going. Today, I want to tell you a little bit about TSET, because if you didn't know, you'll know after you leave here today. I want to talk about a public health win that took bravery, determination, and the discipline to a long-term vision. I'm privileged to lead TSET. It was created by voters after our state sued tobacco companies, like so many, and came to an agreement called the Master Settlement Agreement. We are an endowment that uses the funds from big tobacco and uses those earnings to fund grants and programs to improve health. Every day, we offer Oklahomans resources to make healthy choices and live tobacco-free. In 1996, Oklahoma was the 14th state to file a lawsuit against tobacco companies, holding them accountable for their role in premature death and disease. No one had ever beaten them. In a move meant to reduce legal exposure, the tobacco companies agreed to the terms of the master settlement. Oklahoma's then Attorney General, Drew Edmondson, helped to negotiate the terms of that settlement. As part of the settlement, tobacco companies will pay states each year for as long as cigarettes are sold. When I think about public health wins, the creation of Oklahoma's endowment is among those things that come to mind. History buffs may remember that the first attempt at creating an endowment failed. Then, Representative Jerry Askins from Duncan successfully ran a bill to create a special fund to ensure that payments from cigarette companies went toward improving health, not the general fund or other immediate needs. And the governor vetoed it. But, like hockey great Wayne Gretzky said, you miss 100% of the shots you don't take. So, Askins and Trust supporters went back again. Over the years, I've had the opportunity to have great conversations with former Representative Lieutenant Governor Askins and Attorney General Edmondson. Their perspective reminds me of what an amazing thing our state did in creating a constitutional endowment for health. We're the only state that did that. In recalling the process, Jerry said the legislation being vetoed actually helped. It allowed supporters to tell their story and bring more people to the cause. They held stakeholder meetings. They looked for common goals and support. Midway through that legislative session, it wasn't looking good. Despite having meetings across the state, the coalition was losing hope. Maybe these dollars would just go to immediate needs. Oklahoma had plenty of those. Prisons, roads, bridges, they all needed funding. At the same time, when things looked bleak, there was also a discipline and a commitment to a vision. It was about creating something for future generations. Jerry recalls how one day a member of Senate staff approached her and said, "Okay, we do your trust. How do we do it?" She was ready. There was a plan, a vision, and a groundswell of supporters already educated. This time, the House and Senate agreed to a joint resolution. No approval from the governor needed, just the will of the people. Let me tell you what Jerry said about this effort. This was not about today, but about tomorrow, and about our grandchildren and our great-grandchildren. It's about the next century of Oklahomans. Voters in 2000 would go on to approve the state question that created TSET by more than 65%. TSET's structure was affirmed in 2020 when voters turned down a legislatively created question that sought to change our structure. Bravery, grit, and commitment to a long-term vision by so many state and public health leaders is how TSET came to be and continues. The concept behind TSET is fiscally conservative, We use money from big tobacco rather than tax dollars to fund programs and grants focused on the prevention of chronic diseases. I don't have to tell this crowd how important that is. Today, TSET is starting its third decade, and our state is making great progress, but of course, we still have work to do. Adult smoking is at an all-time low. More than 500,000 Oklahomans have called the Oklahoma Tobacco Helpline. Schools and communities are passing policies that make the healthy choice the easy choice. And we continue to focus on prevention because we have work to do. Impact is not measured by what an individual person or agency accomplishes. Impact is measured by our ability to work together and develop meaningful partnerships with businesses, government, and other entities. We've partnered with the Stevenson Cancer Center, which recently announced that they have been recertified as an NCI designated center, one of 71 in the country. That investment and other research investments has helped to bring more than $1 billion, $500 million, I'm optimistic, $500 million in outside funding. This is about our grandchildren and the next century, just as the framers intended. Stories of change makers are inspiring. It keeps us going. It's heartening to hear that those leaders also had doubts and fears. Stories weave together the fabric by which we measure and motivate ourselves. My path to public health wasn't straightforward. I come to public health by way of newspaper journalism. I got into this work because I believe in the power of telling stories to create change and the duty to tell the truth. I believe we must advocate for people impacted by policy or suffering because their issues are not primed for political discourse. We are committed to serving something bigger than ourselves. I'm the daughter of retired government employees. I am the daughter of parents who attended college on the GI Bill. My father, a Vietnam veteran. My mother, the daughter of a Marine slain in the Korean War. I came to public health because I believe government and policy can help improve lives. My story is proof of it. As a journalist, my job was to tell the stories of the unseen and educate in hopes of inspiring others to work for something better. Truth-telling is key to creating change and sustaining progress. Misinformation can undo progress. It's powerful and it spreads like wildfire. Over the years, Big Tobacco has used shady science and misinformation to keep customers addicted and avoid accountability. Even after the Surgeon General issued a report on the dangers of tobacco use, the tobacco industry continued to deny their plot to addict and harm. In 2006, a civil judge ruled that the tobacco industry colluded together to do this. In her ruling, Judge Gladys Kessler wrote, "Tobacco companies knew about the dangers of tobacco use for at least 50 years, and they consistently, repeatedly, and with enormous skill and sophistication denied these facts to the public, to the government, and the public health community. Misinformation is a threat to the work we do, whether it's vaccines, screening, or tobacco use." The difference between people in public health and the tobacco industry, there are a lot, is that we have an obligation to tell the truth. We must resolve to connect to our communities and be coordinated in our pursuits to get good information out. In the same way that our most authentic relationships require humility, vulnerability, and transparency, so do our relationships with the public. We are trusted sources of information. In a 24/7 news and social media cycle, we must be nimble and responsive, and we have to acknowledge that science is evolving and is the process of constant hypothesis testing. That's the tricky part, and something the future of public health demands. As you complete this phase of training and education, I encourage you to continue to do brave things. Stay committed to a long-term vision for improved health for all. You are leaders in your communities. You are subject matter experts in a world that increasingly discounts the value of expertise and mocks the methods of good science. Continue to use your voice. Tell your story. Share your passion so that everyone can catch your commitment to improving the quality of life of your friends and neighbors. In public health, we often focus on changes that have the largest impact on the largest number of people. We look for big solutions. But we know changing the hearts and minds is about connecting with individuals and listening to their stories and telling their stories. Think of how those early framers of the endowment, they came together, they looked for common goals, and they did not give up. As we continue to seek improvements in state law, close policy loopholes in our state that don't protect all Oklahomans, we must put a face on these issues. People make change because they believe they can, and they believe others like them are also making change. I encourage you to look for champions and nurture them. Sometimes we have to think outside the box, try new things, make mistakes, and learn from them. Just as Oklahoma was a leader in its vision for TSET, we can be visionaries for solutions to create a healthier future. And finally, never forget you are a constituent and a citizen of this state. Show up. Educate, advocate, play the long game. Remember those accomplishments of those who came before you didn't always happen on the first try. It takes courage to keep going, the grit to stay in the game, and the discipline to stay focused. Keep going. The world depends on you to light the path forward. It depends on you to show up when the chips are down. It depends on you to seek to understand, to be curious, and to be compassionate. Offer kindness, err on the side of mercy, and be true to yourself. It is no mistake that you are sitting here today. Remember that. This is not a coincidence. This is not luck. This is your calling and your purpose. Some days, you may have to whisper that to yourself. Other days, you're shouting it at the top of your lungs in the car on the way to work. Whatever it takes, right? The path ahead is exciting, the terrain diverse, and the journey unforgettable. Thank you and congratulations.
All right, and Julie, we have a small token gift that we wanted to give you. Thank you. All right, so why are we here today? Oh yeah, we have to graduate some students today. So I'm going to turn the podium over to Dr. Sarah Vesely, the Associate Dean for Academic Affairs and the David Ross Boyd Professor of Biostatistics and Epidemiology, who will present our candidates for graduation.
We made it to this part of the program. All right, students, are you ready? So students, it's now our pleasure to recognize the students graduating from the Hudson College of Public Health. Students, you'll exit your row to the left, go up the stairs, hand your name cards to me. After I read your name, proceed to be hooded by your department chair or advisor, and then continue across the stage to receive your diploma cover from Dean Bratzler. A photographer will take your picture when you're hooded, when you receive your diploma, and after you exit the stage. So today we're going to begin with students graduating with a Doctor of Philosophy degree and Masters of Science degree. These students will be hooded by their academic advisors or designee. All right, come on up. Afshin Hassan, Doctor of Philosophy and Epidemiology. Hooded by her advisor, Dr. Sydney Martinez. I present to you a student graduating with a Doctor of Philosophy degree in Epidemiology, Dr. Ami Elizabeth Sidani. I present to you a student graduating with a Doctor of Philosophy degree in Health Promotion Sciences, Dr. Amber Suena Anderson Bittner. Hooded by her advisor, Dr. Lancer Stevens. I present to you a student graduating with a Doctor of Philosophy degree in Health Promotion Sciences, Dr. Araya Asfa, hooded by Dr. Kirsten Reinschmidt. I present to you a student graduating with a Doctor of Philosophy degree in Health Promotion Sciences, Dr. Chandra Renell McCage, hooded by her advisor, Dr. Carla Fennell. I present to you students graduating with a Master's of Science degree in Biostatistics. Gideon Hallen, hooded by his advisor, Dr. Daniel Zhao. Sometimes the step's not quite tall enough. Congratulations. Stephen Pan, Master's of Science in Biostatistics, hooded by Dr. Jisha Chen. I now present to you students graduating with a Master's of Science degree in Epidemiology. Michael Ray Clark, Master of Science in Epidemiology, hooded by Dr. Katrin Kuhn. Next, Dr. Gani Devaltov, Assistant Professor in the Department of Health Administration and Policy and the Program Director for the Masters of Health Administration program, will hood the students graduating with a Masters of Health Administration degree. Claire Lynn Banks, Masters of Health Administration. Mackenzie Berg, Master of Health Administration. Reedy Irwin, Master of Health Administration. Houston Gill, Master of Health Administration. Reagan Ingram, Master of Health Administration. Lauren Riley McAdam, Master of Health Administration. Wyatt Montgomery, Master of Health Administration. Matthew Reeves, Master of Health Administration. Angela Sharma, Master of Health Administration. Valentina Vasquez, Master of Health Administration. Melissa Ward, Master of Health Administration. Anastasia Webb, Master of Health Administration. Thank you. Dr. Laura Beebe, Professor and Chair of Biostatistics and Epidemiology, will hood the Master of Public Health students from the Department of Biostatistics and Epidemiology. Anna Bailey. April K. Lopez, Master of Public Health and Biostatistics. Colleen Blazer, Master of Public Health and Epidemiology. Anne Meredith Kapka, Master of Public Health and Epidemiology. Marco Reyes, Master of Public Health and Epidemiology. Zoe Elizabeth Reed, Master of Public Health and Epidemiology. Jackson Seeberger, Master of Public Health and Epidemiology. Now, Dr. Bratzler, Dean, Professor, and Chair of Health Administration and Policy, will hood the Master of Public Health students from the Department of Health Administration and Policy. Mackenzie Colbeck, Master of Public Health and Health Administration and Policy. Hiba Malik, Master of Public Health and Health Administration and Policy. Next, Professor Neil Han, Chair of Health Promotion Sciences, will hood the Master of Public Health students from the Department of Health Promotion Sciences. Desmond Woodruff Delk, Master of Public Health and Health Promotion Sciences. Kinsey Mosier, Master of Public Health and Health Promotion Sciences. Gracie Piercy, Master of Public Health and Health Promotion Sciences. Sarah Rains, Master of Public Health and Health Promotion Sciences, who will be hooded by Vice Provost Jill Rains, her mother. Yes. Back to Professor Hahn. Margarita Driscoll, Master of Public Health and Health Promotion Sciences. Dr. Dale Bratzler, Dean, Professor, and Chair of Health Administration and Policy, will hood the Masters of Public Health Interdisciplinary Public Health students. Make Dr. Bratzler walk back and forth a lot. Dylan Goddard, Master of Public Health in Interdisciplinary Public Health. Farial MTS, Master of Public Health in Interdisciplinary Public Health. Linda Lohr, Master of Public Health in Interdisciplinary Public Health. Professor Neil Hahn, Director of Bachelor of Public Health Program, and Dean Bratzler will present diplomas to the Bachelor of Public Health students, and Sarah King, who is the co-director of the program, is there as well. First, we have Danielle Baca, Bachelor of Public Health. Next, we have Ho Yi Chick, Bachelor of Public Health. Dion City, Bachelor of Public Health. Gloria Gitanga, Bachelor of Public Health. Jeanette Huang, Bachelor of Public Health. Samantha Hopper, Bachelor of Public Health. Brandon Wynn, Bachelor of Public Health. Tiffany Ong, Bachelor of Public Health. Rena Pillay, Bachelor of Public Health. Michelle Sandoval, Bachelor of Public Health. This concludes, I did want to apologize that for Ami, I forgot to announce her advisor, Janice Campbell, so that was at the beginning, so I apologize. Just to recognize that, Ami, I didn't mean to leave that out. So this concludes the reading of the names of the 2023 graduates. I'm so proud of each and every one of you, and at this time, I'll turn the podium back over to Dr. Bratzler.
All right, well, I'm going to turn it right back over to Dr. Vesely here in just a moment. First, let's have one more round of applause for all of our graduates. Certainly, on behalf of the Hudson College of Public Health, all of the faculty and staff, we want to extend our congratulations to each of you. In particular, I always love seeing the Bachelor of Public Health students come across the stage here. We're so happy that you embarked upon this training with us, and we're really pleased to have you here. So I'm going to turn the podium back over to Dr. Vesely to present the Delta Omega inductees this year.
All right. Each year, the college selects several individuals for induction into the Delta Omega Society, the Public Health Honor Society, which recognizes excellence in academic achievement and excellence in public health practice. The salmon color stole I am wearing symbolizes Delta Omega's commitment to excellence. On behalf of the Chi chapter, the Xi chapter of the Delta Omega Honor Society, I'm pleased to announce this year's inductees into Delta Omega. They're also listed in the program. So with the following students, please stand and come to the stage to read your certificates, or to receive your certificates. Anna Bailey. Michael Clark. Just proceed all the way over to next slide. Got to get Dr. Bratzler up again. No sitting at convocation. Mackenzie Colbeck. Desmond Delk. Samantha Hopper. Linda Lohr. Stephen Pan. Sarah Rains. Marcos Reyes. Zoe Reed. And Anastasia Webb. Please join me in extending our congratulations to these new Delta Omega members.
Darn, I forgot my Fitbit today. All right. So at this point, it's my time to, it's really a great pleasure to get to just talk about some of the outstanding students we have in the program. We'd like to recognize those students in the Hudson College of Public Health who completed their academic program with a perfect 4.0 grade point average. If any of you heard President Harris talking at graduation yesterday, he pointed out that he was always envious of those people. So please, as I read your name, just stand up in place and hold your applause until I've read all of the names. Justin Dvorak, Stephen Pan, Claire Banks, Reedy Irwin, Matthew Reeves, Valentina Vasquez, Anna Bailey, Nicholas Holman, Mackenzie Cowbeck, Desmond Delk, Sarah Rains, and Micah Ching. So on behalf of the faculty, we want to congratulate each of you on your outstanding academic performance in the program. I'd also like to take just a moment to recognize the officers of the College of Public Health Student Association. Really instrumental. They provide so much advice to me as the dean. They really do act as stewards of the college and bring so much information back from the students and others to us. So we want to recognize these students that despite all the training and education and other things, they take the time to serve in the leadership role of our college and at the university. So the graduating officers and senators this year are Hiba Malik, please stand. Angela Sharma, treasurer. Zoe Reed, community service chair. Gracie Piercy, social chair. Shafali Patel, senator. And April Lopez, senator. Thank you all. Please give them a round of applause. Thank you. So if you look in your program today, you see in the back that there are many, many awards that have been won by faculty, students, and others in the Hudson and College of Public Health. And I want to acknowledge those because we do have an outstanding faculty that got many awards this year from the Health Sciences Center and from the students. So I want you to recognize those folks that got awards, but we have one more award to give right now. And it is the OUHSC Outstanding Student Award for the Hudson College of Public Health. Each year, this award is given to one student who represents the highest order of professionalism and performance in the Hudson College of Public Health. During his 2 years as a student in this college, this recipient has made significant research contributions to the field of public health. He served as the lead researcher for a project that used Monte Carlo simulation, I kind of know what that is, to conduct a study entitled Empiric Comparison of 3 Commonly Used Imputational Methods for Multivariate Missing Data in Public Health. And he used data sets from the Behavioral Risk Factor Surveillance System and the National Health, Nutrition and Education Surveys, or NHANES data files to do this work. He led the simulation study and the writing of a manuscript and plans to present his research this year at the 2023 Joint Statistical Meeting, which is the largest international statistical conference in the world. Furthermore, he presented his research as a student poster at the inaugural 2022 Oklahoma Biostatistics Conference. This paper was published by the International Journal of Environmental Research and Public Health for a special issue on innovative statistical analysis in public health. Truly an amazing accomplishment for a student in the program. So in addition to his 3 peer-reviewed publications as an MS student, 2 of those as a first author, he was awarded a research grant from the Strong Heart Tribal Approach to Research Projects Program, a noble achievement that is very, very rare for a Master of Science student to achieve. In this project, he is investigating the association between pedometer-measured physical activity levels and the incidence of atherosclerotic cardiovascular disease in Strong Heart study participants. He served as a teaching assistant for Dr. Chen's Biostatistics 2 Methods course. He's provided invaluable support for students, answering questions with great enthusiasm. He's been a true mentor for other students. He comments that Dr. Chen comments that this recipient's ability to interpret sophisticated statistical knowledge and clearly explain these concepts to students with different backgrounds is quite impressive. Also, he's achieved a perfect 4.0 grade point average in his Master of Science in Biostatistics program. He previously had achieved a 3.58 GPA in his Doctor of Pharmacy degree program at the University of Utah College of Pharmacy, and previously earned his bachelor's degree in biochemistry from the University of California, Los Angeles. Given his excellent academic performance, analytic skills, he has already been offered a biostatistics staff position within our college, where he now serves as a biostatistician in our Biostatistics and Epidemiology Research Design and Analysis Center. So we're certainly very proud of this particular student. The recipient, his drive for excellence in academics, his mentorship to other students, and the advancement of health. Please join me in congratulating our outstanding student for the Hudson College of Public Health, Stephen Pan. Congratulations, Stephen. Thank you. Thank you so much. Congratulations again, Stephen. All right, before we end, there's one more group that we have to honor. So I'm going to ask that all of the graduates stand. All of you, please stand. See, they're following instructions pretty well at this point. Okay, now I want you to find your family in the audience, look that direction, and please know that you couldn't have achieved your accomplishments without the support of your family and the many members. Please, all of our graduates, show your appreciation to your parents and families and supporters. All right, thank you. So one last thing I just wanted to mention. You can sit, guys. You know, this year we embarked upon a process to finish up our strategic plan, and our purpose statement for the Hudson College of Public Health is promoting healthier tomorrows through education and research today. And I think you cannot feel inspired, you can feel very inspired by watching the graduates and hearing about the many accomplishments of our students in this program. I really do think we're meeting the mission and the vision of our organization and our purpose statement to promote healthier tomorrows through the education and research that all of you have done this past 2 years. Again, congratulations to you. Thank you very much. So, congratulations to all. Please join us for a reception that will be immediately following. There's a reception off to the right, lots of photo opportunities. Before I end, I have to acknowledge one other group, and that's the staff of the Hudson College of Public Health, some of them sitting in the back, some outside, but we couldn't pull this off without the staff, so please thank them for the work. So I now ask that all of you stand and join us in the singing of the OU chant, which will be led by Reedy Irwin. The words are on the back page of your program. Thank you for being here today, and after the chant, please join our reception.